Hello and welcome in Studio 1, coming to you live from the University of Mindanao. I'm Gabriel Cabading. Gastrostomy tube feeding, also known as a G-tube feeding, is a type of enteral feeding method. It administers highly nutritious formula for clients with nutritional deficiencies. Medications can also be administered via a gastrostomy tube. Gastrostomy tube feeding is indicated to clients with swallowing issues in cases of stroke, neuromuscular disorders, long-term critically ill client on a ventilator, comatose clients, those with nasal-oral surgeries, and clients with extensive esophageal surgeries. Gastrostomy tube or G-tube is a special tube inserted into the client's stomach in order to administer the prescribed formula feed and/or medications. Step 1. Check the physician's order or the dietitian's prescribed and calculated formula feed in the client's medical chart or electronic health record. Step 2. Perform hand hygiene, either washing your hands with antimicrobial soap and warm water or perform a hand rub using a 70% alcohol gel. Step 3. Prepare the gastrostomy tube feeding tray. Step 4. Go to the client's room. Perform hand hygiene with 70% alcohol-based hand gel. Put on a pair of clean procedural gloves. Wear a plastic apron or a gown. Step 5. Identify the client correctly. Use 2 identifiers before performing any clinical procedures. Identifiers are the client's name, ID or hospital number, date of birth, and address. Also check the client's history of allergy. Step 6. Explain the procedure to the client. Step 7. Put client in a semi-Fowler's position or high Fowler's position prior to feeding. Step 8. Perform an abdominal assessment. Check for presence of abdominal distension, hypoactive or absent bowel sounds, pain, nausea, vomiting, and diarrhea. Step 9. Assess gastrostomy tube insertion site. Assess for any redness, swelling, discharges, and pain at the surgical insertion site. Step 10. Check the patency of gastrostomy tube. Aspirate gastric content at least 5 to 10 mL. Then check gastric pH using an enteral feeding pH testing strip. Step 11. Flush gastrostomy tube with 20 mL of water, then administer the correct volume of prescribed calculated feeding formula. Step 12. After administering the prescribed formula feed, flush the gastrostomy tube with 20 mL of water as per hospital's protocol. Step 13. Keep the client in semi-Fowler's position or high Fowler's position for 1 to 2 hours. Step 14. Instruct client to notify the nurse if there are signs of formula feed intolerances such as nausea, vomiting, diarrhea, and abdominal pain. Step 15. Wash used materials with hospital-approved cleaning product and warm water. Keep it dry. Step 16. Perform hand hygiene before leaving the client's room. Use a 70% alcohol-based hand gel. Rub hands until dry. Step 17. Document the performed gastrostomy tube feeding. Let's take a look again on the materials needed for the gastrostomy tube feeding procedure. And that's the way it is. I'm Gabriel Cabading. Thank you so much for watching. Until next time, stay safe everyone.